This is YNN, Growing Up Texas.
I'm Dr. Ari Brown for Growing Up Texas, and today we're talking about sleep. I'm here with Dr. Mark Brown, and I know you take care of adults and kids, and I know adults have lots of snoring problems. What about kids?
They have a lot of snoring. In fact, 10% of children are thought to snore, and 4% of kids have snoring so badly it disrupts their sleep. We call that sleep-disordered breathing.
Wow. Now, what signs can parents be looking for that problem?
Well, sometimes it's pretty obvious. The kid's tired and grumpy, they're emotional, they act out. Sometimes kids become what we call hyperexhausted, where they're just moving all over the place in an attempt to stay awake. In fact, you might be surprised to find that there are some children who have been misdiagnosed with ADHD, when in fact they're just not getting a good night's sleep.
Now, do those kids need a sleep study like adults do?
Well, kids who have Down syndrome, airway problems, heart problems, lung problems, bigger issues, will often need a sleep study to determine how bad the sleep apnea is. But in a healthy kid, we usually don't need one.
And the treatment for kids?
99% of the time, if you take the adenoid and tonsils out, problem goes away.
So it sounds like an ear, nose, and throat specialist is the person to go to if you think your child has this problem.
If your child has other medical problems, a sleep specialist would probably be a good first choice, and then an ENT if need be.
Or maybe someone who does both.
Maybe.
Thanks so much for joining us today. I'm Dr. Ari Brown for Growing Up Texas.